Hi, this is Dr. Jason, evidence-based chiropractor from Toronto. Today I'll be doing a short workout. During this workout, I will be discussing a few running related topics and just exercise and training in general. So stick around if you want to hear what I have to say. Generally speaking, it doesn't matter which sport you participate in, whether or not you are active or not. Strength training is a good way to start building your capacity, and it's actually relatively the risk of getting injured from strength training is actually quite low. Again, benefits: improved strength, improved capacity, improved resilience, self-autonomy, self-efficacy, building confidence. These are all the benefits. Also, there'll be cardiovascular benefits, benefits to our mental health as well. So it's one of those things where the risk is really low and the benefits are just quite high. So definitely worth getting into strength training. The other thing is that while there are some more specific sport-related training, a lot of times we don't need to, in order to stay healthy and active, we don't need to necessarily do specific sport training exercises. Generally, some of the exercises that give you the most bang for your buck are your compound exercises like squats, lunges, bench press, pull-ups, and of course there are different training methods to get different result. That's where you need to be a little bit more specific. For a specific intervention, there will be a specific outcome. So if you're training for strength, then you probably want to increase the weight, lower the number of reps, and work close to failure or to failure. If you're training for muscular endurance, then you want to increase the number of repetitions, lower the weight so it can last a little bit longer. And if you're training for power, then you really need to generate that speed really quickly. So again, probably lower weight and then high speed. Sometimes, again, depending on your fitness level and various things, you may be able to go for many number of reps or just a few reps. So that's the general idea in terms of training. Again, make sure you stay hydrated during your workout. Heart rate is at 136 right now, so definitely with strength training you can have lots of cardiovascular benefit as well. I think part of it is just that you're not getting your heart rate high enough most of the time, especially when you're doing a set of, let's say, 10, 12 repetitions. That's for like a minute, and when you rest, your heart rate decreases pretty quickly. So just as we talked for the last like 20 seconds, now my heart rate is back to around 115. So now let's talk a little bit about running form and running biomechanics. Now, based on the literature, there's no best way to run. And now we're talking about, for example, our foot strike pattern. There's a lot of runners are heel strike runners, and there's the mid-foot strike runners, and then there's the forefoot strike runners. In terms of which way is the best way to run, there isn't one. Usually I tell people to run in a form that's comfortable. Once in a while, change it up so your body is not always getting the same repetitive strain. However, generally, if you're talking about biomechanical efficiency, again, biomechanical efficiency and health are not the same. Biomechanical efficiency wise, generally when we're running fast or when we're running, we want to be more of on our midfoot to forefoot versus, if you're going on your heel, it's just biomechanically a little bit disadvantaged. However, if you've always been running on your heels, it might not be a good enough of a reason for you to run on your midfoot or your forefoot. And vice versa, if you're always running your forefoot and midfoot, if you all of a sudden change into your heel strike, it could predispose you to certain injuries because your body's just not used to it. So if you want to change your gait, change your foot landing for whatever reason, at least do it gradually so your body can slowly get used to it. And of course, in terms of risks of those different heel strike patterns, based on the literature, again, depending on what you read, when you're landing on a heel, there will be a little bit less shock absorption because you're landing right on the bony part of your foot. So there could be more stress to your legs, like your tibia, to your knee, potentially even to your hip. However, when we're exercising, we want that stress. Stress is actually good for us. So in that sense, it's not necessarily a bad thing that you have a little bit more stress to your bony structures because your bony structures can adapt. You just have to gradually increase the intensity. Now, when we're talking about forefoot or midfoot strike, there's a little bit more engagement of your calf muscles, and a little bit more, I guess, activation. Again, don't quote me on this. I could be slightly off based on my knowledge. However, supposedly there will be more calf activation and more quad activation. So there's a higher chance maybe you could pull a calf string, pull your calf, or potentially trigger patellar tendinopathy, just because, again, those areas are being strained a little bit more. And again, it's not because it's a forefoot strike. For those injuries to occur, it's probably more so because the demand is just greater than your body's capacity. Does that make sense? While I'm working on that exercise, I want to talk about injuries. Generally speaking, there's no bad exercise or a good exercise. There's no exercises that makes you more injured, because fundamentally exercise is supposed to make us strong and build capacity. For example, that last exercise, I was working with a rounded spine with weight. Now, the exercise in itself will not cause injury to my discs or any parts of my spine. However, if I don't have the capacity to, and if I push the weight, use the weight too much, push my body to my limit, of course, there's a higher chance for me to get injured. At the same time, if I gradually increase my weight, gradually increase on working on my body's capacity, then that weight will not be enough to potentially trigger an injury. And of course, as we increase the weight, as we work on the exercise, our body becomes more resilient. Our body, our bones, ligaments, tendons, fascia, all the structures and nerves, they actually start to get stronger and become more robust. So that's how we sort of work on, that's why we train, that's why we work on exercises, that's why we run. Now, in terms of running specific injuries, again, depending on the literature, there's, out of how many runners, there are a certain percentage that would likely to get this type of injury versus the other type of injury. So some of the most common ones, you probably have heard of shin splint. Shin splint is essentially a basket term for many conditions that's related to our lower leg. It could be, stress to the tibia stress fracture, or just calf strain, compartment syndrome, may even be tendinopathy of your leg or calf muscles. So shin splint is just a wastebasket term for a whole bunch of different conditions. Now, other injuries that we potentially could get due to running include Achilles tendonitis, tendinopathy. There's a difference between tendonitis versus tendinopathy. I won't go into the specific physiological detail. Again, essentially some sort of repetitive overstrain or a sudden strain to the Achilles tendon, which is right at the heel. Now, another condition would be patellar tendonitis or tendinopathy. Again, that's sort of this part of your knee where your patellar tendon reside. Other conditions, patellofemoral pain syndrome, again, as a collection of symptoms that creates that's characterized by a few different symptoms, and then we call it patellofemoral pain syndrome. Let's see what else. Metatarsalgia, essentially the ball of your foot. That's where you can get some irritation. Sesamoiditis, again, some of those sesamoid bones at the bottom of your big toe that could get inflamed, irritated. Plantar heel pain, another term we used to use, plantar fasciitis or plantar fasciopathy. Again, that's at the bottom, the arch. Those could potentially occur as well. Let's see. What other, ankle sprains, those are fairly common as well. If you sort of roll on the outside of your foot, that's called inversion sprain. You could have eversion sprain, but that's not as common. Other than that, for your hips, you could potentially get trochanteric bursitis, irritation of the bursa on the side of your hip. You could get hamstring strain or pull, tendinopathy of the hamstring. It could be distal at the back of the knee or proximal near your bum area. And what else? Let's see. There's a whole bunch of other conditions you could potentially get. Again, running does not necessarily cause these injuries. Running may, if your body's capacity is low, or if your training volume is just too high, when there's an imbalance of capacity versus demand, of course there's a greater chance for any injuries to occur. However, if we use exercises systematically, we're listening to our body, we're gradually building our body's capacity without exceeding that demand, and then later your body's capacity becomes so high, no matter how high your demand of your sports and your physical activity in general is, your body's capacity still exceeds that demand, and hence in that case you probably will be way less prone to getting injured. Anyhow, I'll get back to training now. By the way, you can tell I'm not the most articulate person, so pardon me if I make some mistakes while I'm talking, or if I use filler words like it's not because I don't know what I'm talking about, it's just that I am not a very articulate person, and I'm trying my best to become a better, more efficient communicator. So I'm working on it. Let's talk about warm-up. Specifically, well, actually not too specific. I'll talk about running warm-up as well. But generally, why do we warm up? What's the point of warm-up? And what does warm-up do? We used to think that warming up is to help us prevent or lower the risk of injuries. However, again, depending on what you read from the literature, running or warm-up doesn't actually do that at least not a whole lot. And now, in terms of warm-up, we don't necessarily need to spend a whole lot of time dedicated to warming up specifically. Now, what does warm-up do? So, warming up does help to prepare our body for the specific demand of our sport or activity. And how do we warm up? Generally, we want to do some warm-up that increases our heart rate, get the circulation going a little bit better, and get our joints and muscles comfortable with moving. So that's essentially what the point of a warm-up is. It doesn't really lower the risk of injury or mitigate the risk of injury. So, for example, today during this workout, you saw I actually didn't dedicate any time doing any specific warm up. I essentially went into my weightlifting at a lower weight, and that is essentially a type of warm up for working on higher weight. In terms of running as well, you can probably do some like joint circles and things like that. However, it's not absolutely necessary. And usually when I go run, I actually do not warm up at all. Um, well, at least not dedicate a portion of time to warm up. I usually go on my run and I start slow and then I gradually build up my speed. So again, that's enough a lot of times as a warm up. Let's see, what else do I want to talk about? Yeah, that's about it actually. Warm up, don't spend too much time. Do a little bit something if you want. If you don't want to do a warm up, just gradually build up your exercise intensity. Okay, let's talk about specificity. Now, I kind of touched upon this topic earlier. However, let me elaborate a little bit more about the concept of specificity. It is said that with a specific intervention or a specific effector, there will be a specific outcome or end result. So, doing exercises, for example. Now, I kind of talked about generally speaking, you don't need to be super specific. However, if you want a specific result from an exercise, then for sure you need to train more specifically. So I want to talk about strength training and mobility as an example. So generally speaking, when we train like squats or bicep curl, if we go through the full range of motion, then we're working on the more our strength and at the same time our mobility, which is your active controlled range of motion. So in that sense, that exercise is specific enough for your mobility. However, if we want to train for our mobility, but I'm only curling biceps, or I'm only doing like half or mini squats, then it won't be enough to work on our mobility. So that's where some of my additional training and certification comes into place. So I've taken a course called Functional Range Conditioning and another course called Functional Range Assessment. So during this course, they talk more so about mobility, and also they talk about training, how we can become effective so that we can get the most gains from our exercises, the most strength, most range, and most control. So when we're talking about mobility, it's a lot of time people think, it's a passive stretch. However, that's only one part of mobility, and itself is not specific enough actually. And based on the literature, stretching doesn't really do much other than giving us some potentially temporary relief of our tightness, tension, and maybe temporary increase of range of motion. It's not sustainable and doesn't make you more resilient or more strong. So when we want more mobility, we need to do specific mobility exercises, which may include things like CARS, controlled articular rotations, PAILs and rails, which stands for progressive angular isometric loading, regressive angular isometric loading. There's a whole bunch of other exercises like passive range liftoff, hovers, ENG, eccentric nerve grooving, those type of exercises. Maybe in the future I'll go into a little bit more detail. So what I'm trying to say is that mobility is a combination of our range and our control and strength, or even power within that range. So let's say if I always squat down to here, and I won't be able to progress further until I try to squat further down lower. And sometimes that may be limited by our range of motion at your hip, at your knee, or at your ankle that's preventing you from going further. So one way to address that, maybe you can put some more weight onto your bar to force you into a deeper squat. However, if your body's not ready, there's a higher chance for you to get injured. And then if your body's not ready, if you don't have that range, then if you're trying to push that range at that high of a weight, it's just not a great equation. So with mobility training, we're doing specific isolation exercises at each joint so that we can increase and expand the joint range of motion or capacity. And then we can use specific exercise to increase the weight at which we work on those joints. So we're gaining strength and control as well. And then when we put those things together, and then when we go back to doing a deep squat, then most likely we're going to be able to squat deeper and with more control and more strength. And combination of mobility training, which is essentially a type of strength training at your end range or closer to end range, plus your conventional strength training like squats, lunges, and deadlift and things like that, then you're going to become a way more capable, resilient, and functional person. Again, I use the quotation functional because that's another topic, but generally there's no functional exercise. A lot of times people say, oh, a squat, a lunge, a deadlift, those are functional because they mimic the daily activities that we do, but isolation exercise is not functional. In my opinion, and the opinion of many in my field, every exercise is functional because they serve a specific purpose to make our body a little bit more adaptable and robust and resilient. So for example, a bicep curl, it is an isolation exercise. However, how functional is that? Well, how often do you lift things with your arm throughout your day? How often do you pick up a mug and drink your coffee? How often do you pick up your grocery, your kids, anything, you lift your laptop? That is the same movement. So a bicep curl, even though it's an isolation exercise, it's still very functional. So that's why every exercise is functional. There's no such thing as really functional exercises. So yeah, that's my 2 cents. Actually, I'm gonna conclude this workout because I gotta get ready and go to work. So I will post this on YouTube. So whenever you see this, that's whenever it's up. If you have any more questions, please send me a DM on Instagram, or you can leave me a comment on my YouTube video, and I'll try my best to get back to you. Again, this is important for me to express some of my thoughts, but at the same time, I want to use my platform to educate so that some of the misinformation or myths in my field can be debunked, so that a lot more people can benefit from the benefits of exercise and being active. Anyhow, until next time, peace.